My private practice here in Savannah, Georgia is sort of multifaceted, but there's a special emphasis on childhood and adolescent trauma. I am certified in this area, and I see a lot of children and families who have been plagued by trauma in their lives. What does trauma work look like? Well, trauma is, firstly, let's identify and define trauma. Trauma is any event that has posed as a life-threatening event, or even if there's a perception that this event could be life-altering. So it varies from person to person, but the normal response is for a person to go from trauma through the recovery process or the recovery phase without further incident. So what that means is basically we all have a mental, emotional, and physiological response to trauma. However, there are those individuals who experience trauma on a deeper level and they are not successfully moving through the recovery phase as they should. So what happens is a person is basically stuck in a particular aspect of the trauma. Flashbacks, intrusive thoughts and memories, and intrusive thoughts and memories are basically recurrent thoughts and memories that one has that interferes with their ability to function throughout the day. So what we see is the flashbacks, the intrusive thoughts or memories, hypervigilance, where you're extremely jumpy. We also see a sort of dissociation, which is basically when you zone out. And zoning out is when the mind is basically trying to escape the trauma. And of course, with the mind and body so intricately connected, the body responds to the mind by being in sort of a daze. So there are a number of symptoms associated with post-traumatic stress disorder. And it is very important that as educators, as parents, caregivers, that we understand what trauma looks like. Sometimes trauma symptoms do not show for a prolonged period of time. So you may have the traumatic event and you don't see the symptoms until much later. So what I do see a lot is parents or foster parents or caregivers coming in and they'll say something along the lines of, oh, well, the trauma happened, 4 or 5 months ago, and all of a sudden this child is behaving this way. So I don't really think it's related to the trauma. And as I begin the psychoeducation piece of the session, I explain that each person experiences trauma in a different way. Children have a very interesting way of showing symptoms of trauma. You may not see the flashbacks. You may not know about the intrusive thoughts or memories. Doesn't mean that they're not there. Nightmares may be a symptom for both adults and children, but also you may see some bedwetting incidents. You may see some outbursts, emotional outbursts with your children. And this occurs as the child is basically trying to move through the recovery process, but they have no clue how to do this. So it is my role as a psychotherapist to teach anyone involved with a child who has experienced trauma, to teach them to not only identify what the trauma looks like with their children, but also how to work with the child as they move through the recovery process. And it can be very different for each child and or each family member. Some children begin to daze off in school. Some children begin to refuse to go to sleep at night. They may refuse to complete their work in school. And this occurs most often because it is during the quiet periods that the children are beginning to experience some flashbacks. This is when these intrusive memories are more likely to occur because everything is quiet. The more distractions you have, the more diversions you have, the less flashbacks that the person may experience. So what we're looking at is a child who is having a difficult time coping with what they're seeing in their mind, or actually what they're feeling. Sometimes they may not have the actual flashbacks to appear right before their eyes. They could experience an emotional flashback. So they are actually becoming very afraid or very anxious or very angry during this period. And these are other examples of how flashbacks can occur. So sometimes we're not looking at a defiant child. We're not looking at an angry child. We are simply looking at a child who is struggling with the trauma. There is so much work involved in working with children who are diagnosed with PTSD. Only trained, skilled clinicians should work with children who have been diagnosed with post-traumatic stress disorder, because it is a very, very intense diagnosis, and if not properly treated, the child can experience even further emotional and behavioral disturbances. So my recommendation is always for parents, caregivers, foster parents, caseworkers to refer to a therapist who has specialized training in this area. It is critical that the child is able to process the trauma. If left undone, you are basically reinforcing the continuation of these symptoms. These symptoms must be addressed, and they must be addressed skillfully. So there's more work, there is more information that I have on trauma, and I would like to probably post some more videos later and share a training manual that I completed in November of last year. I actually did my first training where I was actually offering CEUs to licensed professionals. It was very, very good, and the manual is very thorough, and I'll share that in a later video. So that is it for now. I'm actually preparing for my next session, so I hope to see you all soon. Bye.